My dear children, today's topic is phobia. It's very common nowadays. And phobias are one of the most common mental disorders in the United States. And now, case study. Yes. And seeing a spider makes me rigid with fear, hot, trembling. I have occasionally vomited and once fainted in order to escape from the situation. These symptoms last 3 or 4 days after seeing a spider, and realistic pictures can cause the same effect. And next, what is phobia? And phobia, the Greek word, the meaning is fear. And you know, fear is our negative emotion and fear is normal. But when we call phobia, and the last class also you know, and what is fear, what is anxiety. And now, phobia is a part of anxiety disorder. So what is phobia? Phobia is a persistent, irrational and unreasonable fear of a particular object, activity or situation. The important thing is that it's a persistent, irrational, illogical fear. Yes. And now phobias often develop gradually or begin with a generalized anxiety disorder. You already know what is generalized anxiety disorders. And now, types of phobia. It's a specific phobia, social phobia or social anxiety disorder, and agoraphobia. And the important thing is that phobia is more intense and persistent. And the desire to avoid the object or situation is greater. Yes, that is important. And people with phobias often feel so much distress that their fears may interfere dramatically with their lives. Yes. And this picture just illustrates, fear of height, acrophobia. Now, the case study is based on specific phobia. Just the name specific phobia and listen carefully this case study. Mary, a married mother of 3, was 47. At the time, she first sought treatment of both claustrophobia and acrophobia. She reported having been intensely afraid of enclosed space and of heights since her teens. And so just to notice symptoms. Yes. She traced the onset of her claustrophobia to those traumatic incidents. But she had no idea why she was afraid of heights. Her children were now grown. She wanted to find a job outside her home. This was proving to be very difficult because she couldn't take elevators and was frightened being on anything other than the first floor on an office building. So that is important, the important symptoms. And her husband had for some years been working for an airline, and which entitled him to free airline tickets. And the fact that Mary couldn't fly. Yes. So what is specific phobia? Specific phobia are most commonly occurring type of phobia. Yes, is very common. And this group includes irrational fears, such as intense fear of a certain type of animal or being in an enclosed space. And most common mental disorders and specific phobia, obviously most common mental disorder among women. And the fear and anxiety or avoidance is persistent, typically lasting for 6 months or more. Yes. So, and this, the duration is important for diagnosis. And now various kinds of specific phobia for your informations. Animals phobia, you know, zoophobia. Books, bibliophobia. Darkness, nightphobia. Water, hydrophobia. Heat, thermophobia. Heights, acrophobia. And spiders, arachnophobia. Okay. And the next, you know, social anxiety disorders or social phobia. And again, one case study. Yes, case studies are very important, you know, children. And especially for clinical psychology. Case studies are important for all disciplines and the areas of psychology also, but especially for clinical psychology. Okay? And Paul was a single white male in his mid-30s. When he first presented for treatment, he was a surgeon who reported a 13-year history of social phobia. He had very few social outlets because of his persistent concern that people would notice how nervous he was in social situation. Yes, identify the symptoms, children. He had not dated in many years. Yes, and he particularly worried that people would notice how his jaw tensed up when around other people. And he had no particular problems talking with people in professional situations. He was quite calm talking with patients before and after surgery. During surgery, when his face was covered with a mask, he also had no trouble carrying out surgical tasks or interacting with the other surgeons and nurses in the room. The trouble began when he left the operating room and had to make small talk and eye contact with the other doctors and nurses or with the patient's family. Yes. He frequently had panic attacks. At the next class, and I will discuss about panic attacks. Panic attacks mean sudden anxiety attacks. And panic attacks in these social situations. During panic attacks, he experienced heart palpitations and fears of going crazy, sense of his mind shutting down. Yes. And now, what is social phobia or social anxiety disorder? Social phobia and is characterized by disabling fears of one or more specific situations, social situations. The public speaking, urinating in a public bathroom, eating or writing in public. And the important thing is that a person fears that she or he may be exposed to the scrutiny and potential negative evaluation of others. That she or he may act in an embarrassing or humiliating manner. Yes, that means thinking pattern is also important. Yes, and the social situation are avoided or endued with intense fear or anxiety. And the fear, anxiety or avoidance is persistent and lasting for 6 months or more. And social phobias as learned behavior. Yes. And now next, you know, agoraphobia. And agoraphobia is the term used when people develop a fear of entering unfamiliar situations. Students, you have to mention entering unfamiliar situations. Many people with agoraphobia are afraid of leaving their home. And so their ability to carry out normal life activities is severely limited. And situations frequently avoided by people with agoraphobia, crowds, and standing in line, theaters, restaurants, shopping malls, sports areas, cars, buses, trains, airplanes, bridge, tunnels, etc. And now, only for your knowledge, okay? the causes of phobia. And behaviorists said that the classical conditioning is one of the important factor of developing phobia. Yes, and the modeling also. And other important, cognitive factors. How we think. Cognitive factors also play a role in the onset and maintenance of social phobia. And Beck, cognitive theorist, Beck suggested that people with social phobia tend to expect that other people will reject and negatively evaluate them. Yes, that is important. And expect that other people will reject or negatively evaluate them. Yes, that is important. And for treatment, and we can use behavior therapy, cognitive therapy, and use under behavior therapy systematic desensitizations. Thank you, my children.